Hey everyone, welcome back to the channel. This is Brian K. Dorsken from Greenwald International Company, and today we are going to learn about arthritis, and later on I will give you the arthritis care package that we offer here in Greenwald International Company. Welcome. So let's dive in. So what is arthritis? Arthritis is simply defined as inflammation of one or more of your joints. A joint is where the ends of bones meet, such as your knee joint, shoulder joint, or the small joints in your spine. Inflammation is one of your body's normal reactions to injury or disease. In an injured or diseased joint, this results in swelling, pain, and stiffness. The most common types of arthritis are osteoarthritis and rheumatoid arthritis, but there are more than 100 different forms. Although arthritis is mainly an adult disease, many arthritis-related diseases also affect children. Now, what is osteoarthritis? Osteoarthritis is the most common type of arthritis, also known as wear and tear arthritis. Osteoarthritis often occurs during middle age, and it develops slowly, and the pain it causes worsens over time. And we know that osteo means bone. In anatomy, healthy joints move easily because of a smooth, slippery tissue called articular cartilage. Cartilage covers and protects the ends of your bones where they meet to form a joint. Osteoarthritis causes this cartilage to wear away. And how does it happen? Osteoarthritis occurs over time. When the cartilage wears away, it becomes frayed and rough. Moving the bones along this exposed surface causes pain. If cartilage wears away completely, it can result in bone rubbing to bone. To make up for the lost cartilage, the damaged bones may start to grow outward and form painful bone spurs. What are the symptoms of osteoarthritis? The most common symptoms of osteoarthritis are pain, stiffness, and swelling around the joint. Symptoms tend to be worsened in the morning or after a period of inactivity. What is rheumatoid arthritis? Rheumatoid arthritis is a chronic disease that can affect many parts of your body. Rheumatoid arthritis most often starts in the small joints of your hands and feet. It usually affects the same joints on both sides of the body. For example, if you have pain and swelling in your right knee, you also have pain and swelling in your left knee. Many joints are often affected at the same time. In anatomy, the joints of your body are covered with a lining called synovium that lubricates the joint and makes it easier to move. Rheumatoid arthritis causes the lining to swell, which causes pain and stiffness in the joint. How does it happen? Rheumatoid arthritis is an autoimmune disease. This means that the immune system attacks its own tissues. With rheumatoid arthritis, instead of protecting the joint, the immune system begins to produce substances that destroy the joint, as well as the ligaments, tendons, and muscles that support it. This can result in joint deformity, such as bent, gnarled fingers, and loss of movement. What are the symptoms of rheumatoid arthritis? Autoimmune diseases affect your whole body. Rheumatoid arthritis can cause not just joint pain and stiffness, but fever, loss of appetite, and fatigue. Because it is a chronic disease, rheumatoid arthritis is a lifelong condition. Symptoms, however, may disappear for a period of time, then flare back up. What are common treatments? Because arthritis worsens over time, the sooner you start treatment, the better. There is no cure for arthritis, and without treatment, it will progress and possibly cause serious disability. It is important to work closely with your doctor to create an effective treatment plan, one that you can easily follow. Most people find that some combination of treatment methods works best. Lifestyle changes. Your doctor may recommend lifestyle changes to protect your joint and slow the progress of the disease. Exercise. Regular exercise can decrease stiffness and strengthen the muscles that support your joint. If you regularly do high impact exercise, running for example, switching to low impact activities will put stress on your weight bearing joints. Walking, cycling, and swimming are good low impact options. Weight loss. If you are overweight, losing just a few pounds or kilograms can make a big difference in the amount of stress you place on your weight bearing joints. Losing weight can also make it easier to move and maintain independence. Physical therapy. Specific exercises can improve the range of motion in your affected joints. Brace, splints, or shoe inserts can also help relieve arthritis pain by reducing stress on your joints. Medications. There are a range of medications that may help relieve pain and reduce inflammation. Acetaminophen. Mild arthritis pain is often relieved with acetaminophen. Nonsteroidal anti-inflammatory medicine. Anti-inflammatory medicines. Drugs like aspirin and ibuprofen reduce both pain and swelling. Steroid injections. Cortisone is a powerful anti-inflammatory medicine that can be taken by mouth or injected into the painful joint. Disease-modifying anti-rheumatic drugs. These medicines are used to slow the progression of rheumatoid arthritis. Drugs like methotrexate, sulfasalazine, and gold injections are designed to stop the immune system from destroying the joints. Surgery. Your doctor may consider surgery if your pain worsens and causes disability. Osteotomy. The bones that make up a joint, such as those that make up the knee, are cut and realigned. Synovectomy. The diseased and damaged joint lining caused by rheumatoid arthritis is removed to reduce pain and swelling. Fusion. In this procedure, the ends of the bones are fused together. This prevents joint motion and relieves pain. Joint replacement. This surgery removes the damaged joint and replaces it with an artificial device. Living with arthritis. Learning you have arthritis can be discouraging. In addition to the many treatment options for arthritis, there are things you can do to lessen the impact the disease has on your life. 1. Talk to your doctor. If your symptoms worsen or you are having a hard time coping, your doctor can review your treatment plan. 2. Consult a physical therapist. A physical therapist will teach you exercises to improve your strength and flexibility. A therapist can also help you find new ways to do everyday activities. Simple changes like using a reacher to pick up low-lying things can make a huge difference in relieving joint pain. Your therapist may suggest assistive equipment for your bathroom, like a shower bench, elevated toilet seat, and handrails. Number 3, get plenty of rest. Arthritis can make you more tired, and your arthritis symptoms may worsen when you are fatigued. Try to get a full night's sleep and take short naps during the day if you need to. Discuss alternative medicine with your doctor. Some alternative therapies appear to help arthritis pain. Talk to your doctor before trying any alternative treatments. They could interfere with your treatment plan. Now, let us discuss the arthritis care package that we offer in Greenwald International. There are many more other products, but for today, we are going to discuss only those few. We have compound marrow powder. We have deep sea fish oil capsule. We have arthropower capsule. We have bone care plaster. We have calcium capsules. We have kidney tonifying capsule for men and women. We have multivitamins tablet for adults. I'm going to start with the bone care plaster. How does it help to cure arthritis? In the bone care plaster, there are 10 pieces per bag. A plaster applied externally on painful or swollen joints to ease the pain and reduce the swelling. So it helps to ease the pain and reduce the swelling. What are the health benefits of bone care plaster? Expels pathogenic wind, dampness, and cold from the painful joints. Improves blood circulation and reduces blood stasis. Eases the joint pain. Recommended use for arthritis, scapulohumeral, periarthritis, cervical spondylosis, lumbar muscle strain, lumbar disc herniation, traumatic injury, lumbago, tennis elbow, arthromeningitis, and joint sprain. How do you use the bone care plaster? Stick the plaster on the tender joint. Each piece can be used for 2 to 3 days with an interval of 4 to 6 hours. Apply the plaster on cleaned and intact skin. To the kidney tonifying capsule for men. It restores and enhances the detoxification and other functions of the kidney. Health benefits. Improves kidney fatigue, which demonstrates in leg and lumbar pain, insomnia, forgetfulness, listlessness, lowered libido, or sexual dysfunction. Invigorates kidney functions. Improves impotence in men. Recommended use for men who is middle-aged or elderly. For men with leg and lumbar pain or lowered libido. How do you take kidney tonifying capsule for men? 4 capsules each time, 1 to 3 times in a day. Kidney tonifying capsule for women. It strengthens kidney and boosts immunity. Health benefits. Invigorates kidney functions. Prevents and alleviates certain female chronic infections such as cystitis or urethritis. Improves infertility of women. Regulates ovaries functioning to balance female hormones. Recommended use for women with irregular menstruation, For women with compromised intercourse. For peri or postmenopausal women. For women with pain in legs and waist or fatigue. How do you take kidney tonifying capsule for women? 4 capsules each time, 1 to 3 times in a day. Arthropower capsule. It helps alleviate the inflammation of the joints and muscles. Health benefits: alleviates the pain, swelling, and stiffness of the joints. Helps joint cartilage repair and rebuild. Recommended use: for those who have joint injury, for those who have degenerative joint diseases such as osteoarthritis. How do you take Arthropower capsule? 2 capsules each time, twice in a day, preferably with a meal. Deep sea fish oil capsule. It provides essential fatty acids, prevents cerebral or cardiovascular diseases. Health benefits: provides EPA and DHA, the 2 major omega-3 fatty acids, polyunsaturated fatty acids, and vitamin E. Improves brain functions. Improves blood lipid index. Reduces platelet coagulation and the risk of atherosclerosis and heart attack. Recommended use: for those with hypertension, hyperlipidemia, and hyperglycemia. For those with cerebral or cardiovascular diseases. For those with memory loss or senile dementia. How do you take deep sea fish oil capsule? 1 to 2 capsules in a day. Calcium capsule. Human body needs calcium to build and maintain strong bones. It also plays an important role in the proper functioning of heart, muscles, and nerves. Recommended use: for all age group, especially adolescents, postmenopausal women, and the elderly who need higher calcium intake. It is safe for pregnant women and nursing mothers. How do you take calcium capsule? Each capsule provides 225 mg elementary calcium, 1 to 2 capsules each time, once in a day. Compound marrow powder. It enhances kidney function, improves memory, and strengthens the bones. Health benefits: provides calcium and phosphorus for building of the bones. Provides iron and vitamins for synthesis of hemoglobin, thus preventing and improving anemia. Provides proteins and essential fatty acids. Taurine potentially protects retina and brain against free radical damage. Accelerates fracture healing. Recommended use: for all age group, especially the elderly, and those who are physically unfit or in convalescence. For those with calcium deficiency and osteoporosis. For women in the peri or postmenopausal period. How do you take compound marrow powder? 1 to 2 sachets in a day. It can be prepared with water or milk or mixed with cereals. Multivitamins tablet for adults. It supplements the daily essential vitamin intake. Health benefits: it supplements the body with fat-soluble vitamins, that is vitamin A, vitamin D, vitamin E, and vitamin K, and water-soluble vitamins, that is vitamin B complex and vitamin C. Prevents and improves vitamin deficiencies. Recommended use: for adults. How do you take multivitamins tablet for adults? 1 to 2 tablets per day. I hope this session was helpful. Remember to share, like, and subscribe for more insights like this.